Hi, my name's Jessie. I've been an acute care nurse for the last 5 years, and I'm currently working towards my doctorate of nursing practice at Gonzaga University. The following policy will be implemented in all primary care and acute care settings across the United States. When a patient is diagnosed with a terminal illness, either in a primary care setting or during a hospital stay, time-sensitive palliative care must be initiated. 1. If the patient receives a diagnosis of terminal illness or poor prognosis in the primary care setting, the healthcare provider must allow for a 45 to 60-minute appointment in conjunction with a palliative care specialist to fully discuss treatment options. 2. If the patient receives a diagnosis of terminal illness or poor prognosis in an acute care setting, all members of the medical team and palliative care representative must meet with the family within 24 hours of admission or diagnosis. Follow-up meetings will be held every 24 hours. Research suggests that a slower, incremental approach proceeding with patients over a series of discussions is more efficient and effective for patient and family rather than abrupt decision making. Although there is a growing practice of palliative care for patients with chronic illness, there are no universal standards or protocols implemented in primary care, acute care, or nursing home settings. When a provider gains an understanding of a patient's idea of quality of life, he gains a profound insight into the patient's vision of his end-of-life care. With continual medical advances, patients with terminal illness walk a fine line between being a beneficiary or a sufferer of modern medicine and treatment. Approximately 5 to 10% of all patients living with functional dependency, serious illness, and multiple chronic conditions use over half of the nation's healthcare costs. The current healthcare system is financially unsustainable, and many settings are unable to provide quality care. Palliative care is uniquely poised to be at the forefront of these inevitable changes in healthcare reform. In addition to the cost-saving benefits, palliative care improves the quality of life of patients and their families facing the problems associated with life-threatening illness. Provisions related to quality palliative care were removed from the Affordable Care Act of 2010 because of poor perception and ideas of death panels began circulating. This is not a death panel. Communication of prognostic information is challenging, and the palliative care specialist is available to assist the patient and family in understanding prognosis, quality of life, and wishes. The window of opportunity to discuss implementation of palliative care consults is now. Palliative care is a vital part in caring for patients with terminal illness. Studies support that palliative care teams demonstrate high patient satisfaction, reduce hospitalized care, and reduce Medicare costs. This policy is the change we need for healthcare reform. Thank you.